We're going to do a nitroglycerin update. You'll see nitroglycerin is in two different protocols. It's for our basically chest pain protocol, basically non-traumatic chest pain protocol, and it's also in our congestive heart failure protocol. So first for the chest pain cases. These are two completely different diseases. I know they're both based on heart disease, but they're really two different indications completely. And you've heard me say this before, nitroglycerin for somebody having a heart attack, having a STEMI, does not decrease the death rate, nor does it decrease the infarct size. Its only utility in those folks is to reduce pain. And what we found recently is that in addition to the inferior wall STEMIs, where we know nitroglycerin can crash the blood pressure, nitroglycerin can actually crash the blood pressure in all STEMIs. In fact, 1 out of 10 STEMIs will have a crash in their blood pressure from nitroglycerin. So we really don't want to give nitroglycerin for for non-traumatic chest pain unless you've first ruled out a STEMI on EKG. So if you've ruled out STEMI on EKG and it's non-traumatic chest pain, now you can give nitroglycerin to those folks. But again, keep an eye on the blood pressure. Now for congestive heart failure. Now here's where nitroglycerin actually shines. While I'm not a huge fan with nitroglycerin in the chest pain / STEMI cases, it's actually a life-saving drug in the congestive heart failure patients. In these people, you're given the nitroglycerin to increase the venous capacitance. So basically, it allows you to park all that extra fluid into the veins because it dilates all the veins. So the way we give it is sublingually. Number one, you do not need an IV before you give sublingual nitroglycerin to these cases. That's been well documented. The odds of crashing their blood pressure and you needing to give them a big bolus of fluid after giving a couple of sublingual nitros is really, really small. So you do not need to wait for the IV access before you start giving sublinguals. Keep in mind, patients take nitros all the time without IVs. Number two is you're going to give 2 nitros right off the bat. What's the reason for this? Well, it has to do with something we call bioavailability. When you take a medication, the percentage of the medicine that's actually absorbed into the body and works on the body is what's called bioavailability. The bioavailability of nitroglycerin is rather small, so to give 2 of them at the same time is really not a big deal and is actually a little more effective than giving just 1. Now, once you have CPAP mask on though, we don't want to take the CPAP mask back off to give them more nitroglycerin. It has to do with what we call breaking the seal, so to speak. Once you have that seal in there and you're letting the CPAP do, which is another amazingly life-saving treatment modality in these folks with congestive heart failure, you do not want to do anything to interrupt that. So 2 sublinguals right away, then toss the mask on, and the mask stays on unless the patient vomits or there's some other reason to take the mask off. Mask doesn't come off for more nitro. Then you can put nitroglycerin paste on them. Now nitroglycerin paste is absorbed slowly, so it's going to take a little while, which is why you want to give the 2 sublinguals right off the bat to get some nitro into their system. Now if you put nitroglycerin paste on their chest, one of the errors that we sometimes see is some of the folks are putting the Tegaderm or those IV covers on that stuff. That's not the right cover for it. Just use the paper that comes with the nitroglycerin. It's specifically designed for nitro paste for those people.